All right, I wanted to do a quick video with a further explanation on a differential diagnosis, what it is, and how it's best used. Now, during the office hours last week, I gave kind of an oversimplified explanation of differential diagnosis, and I wanted to take a step back and explain that with much more kind of in-depth or nuanced answer to that. So, a differential diagnosis, kind of generally speaking, is an attempt to find a group of, or find a diagnosis or come to a diagnosis when multiple symptoms overlap between potential conflicting or additional diagnoses. So for example, let's take a look here. We've got two concentric kind of circles or a Venn diagram overlapping each other. A differential diagnosis is when we start having symptoms of a diagnosis that is overlapped with a symptom of another diagnosis. So let's just take, for example, and this will be kind of one where you have, let's say, maybe depressed mood, here in the middle you're having a client, then you're having maybe concentration issues, and maybe a little bit of agitation, and maybe some social isolation. So let's say we had kind of these symptoms come up, and here we are, and maybe the person presented primarily with depressed mood. So, originally we might be leaning towards a major depressive disorder as the primary diagnosis. However, if you look in the DSM, under the differential diagnoses within the major depressive disorder category, it's interesting because one of the differential diagnoses is also ADHD, attention deficit hyperactivity disorder. And you may think, okay, so why exactly is that listed? And the reason is a differential diagnosis, once again, is when the symptoms of various different disorders begin to overlap with one another, and therefore you're trying to sort out which of the two diagnoses it is. Now, during my office hours, I oversimplified it, to be honest, by saying, once you have these overlapping symptoms, you really got to choose one or the other. And that's where my mistake was in kind of reevaluating that. What it means is that you should look at those overlapping symptoms, and for the most part, within the DSM, it does want you to decide between one or the other. However, and this is the exception to the rule, is that you really should read more in depth in the DSM as far as a differential diagnosis, because there are little tiny sentences, little tiny caveats that will say essentially that although these symptoms overlap, if they're distinct enough and they meet the criteria for both diagnoses, you can give them both diagnoses. So it's kind of a misleading little section when they talk about differential diagnoses and list them out, is that it's always kind of been my understanding that you use that to decide, okay, is it major depression or ADHD? And then you figure it out and you move on. Again, it's a little bit more nuanced in that, because there are differential diagnoses descriptions that say, well, these symptoms right here in the middle might be in common with one another. However, they also might have enough symptoms of ADHD and enough distinct symptoms of major depression, that they are their own unique diagnoses and can be given to the same individual. So it's not a one or the other. It's mostly saying, hey, if you can come to one or another decision, great. If not, if they meet both categories of the illness, then it's appropriate to give both diagnoses. So I'm going to show an example of this here in the next part of this little video to demonstrate how the DSM kind of sneaks those phrases in. So I wanted again to explain and clarify what a differential diagnosis is. It's these middle symptoms where two disorders begin to overlap and have a commonality. And so it is up to you as a clinician to decide kind of which of those symptoms best fit the criteria of the disorder. And typically, as I stated in class, it really is to say, is it this or is it this? However, you do need to read more in depth in that description, because there are times where, although they have those symptoms in common, if they have enough symptoms within their own distinct diagnoses to meet those as well, it is possible to have and give them the diagnosis, both diagnoses at the same time. So let me stop this here and I will jump to an example. Okay, here we go. So here's a couple of examples where it can be a little bit tricky. So if we look in the generalized anxiety disorder category, so GAD, if you look at the differential category, you'll see that panic disorder is listed as a potential differential diagnosis. This would lead us then to believe, according to my explanation as well, that you either have to choose between generalized anxiety disorder or panic disorder, that it has to be dropped in one of those two buckets. That was way oversimplified, so let me go and give this example of how the DSM lays it out, the argument that you should tease out, is it one or the other? However, then they do this little caveat that says, well, if enough symptoms are met, unique enough, distinct enough to have both diagnoses, then you can. So again, it's kind of a misleading statement, but let's figure this out. So if you look in the generalized anxiety disorder, it says panic attacks that are triggered by worry, and generalized anxiety disorder would not qualify for panic disorder. So it pretty much says, in the context of generalized anxiety disorder, if a person has a panic attack, then you shouldn't give them panic disorder. And then here it comes. Here they kind of drop the bomb. However, if an individual experiences unexpected panic attacks as well and shows persistent concern and worry about behavioral change because of the attacks, then an additional diagnosis of panic disorder should be considered. So that's why it is important to read the entire differential diagnosis, diagnostic criteria description in the DSM, because there are these little tiny howevers, or stating that if they meet both, it is appropriate to give both. So generally speaking, it's to help guide us to choose one or another. However, that is oversimplified, so definitely look for these little caveats where it says, well, if there are these certain conditions, then you can diagnose it. The other example below is with major depressive disorder. So as I explained in the first part of the video, here is an example of attention deficit hyperactivity disorder. So they talked about distractibility and low frustration tolerance can occur in both ADHD and major depression, right? There's this irritability, they can be frustrated. There can actually even be kind of a lack of sleep or difficulty sleeping as additional symptoms that are in common between these two. And so it says, pretty much that, okay, do you choose ADHD or do you choose major depression, depressive disorder? However, it once again says that if the criteria are met for both, ADHD may be diagnosed in addition to a mood disorder. And then they throw in another, this is where it's so interesting. Then they throw in another, however, the clinician must be cautious not to overdiagnose a major depressive disorder in children with ADHD, whose mood is characterized by irritability rather than sadness or loss of interest. So even then, they kind of give a caveat to their caveat by saying that it should be more sadness and loss of interest than irritability. So definitely read through it. I just wanted to give this little video to give a little bit more nuanced answer and an in-depth answer, that definitely read through those differential diagnoses, because they do have these little sentences or two that help explain whether or not you should be choosing one or another exclusively, or whether they can be given together under certain circumstances. So there you go. We all learned something. Thanks so much. And here's differential diagnoses.